We have seen in the past few days that we have reached a plateau in the number of cases, and our public health experts also expect the number of new hospitalizations to stabilize. This is good news. But we must remain careful. In general, it is the unvaccinated people who got the sickest. The pressure remains present in our hospitals as well. Every day, an average of 25 people, new people, enter the hospital and intensive care unit. And they are still mostly people that are not adequately vaccinated. So please go and get vaccinated. Now, with regards to the third dose, if we look at the situation in recent week, we also see that we are starting to have outbreaks again in living environment such as CHSLD, RPA, et RIRTF, despite an excellent vaccination rate. This is also why the obligation to wear a mask in the common areas of RPAs has been put back. Based on the recommendation of the Quebec Immunization Committee, Public Health therefore decided to administer a third dose to CHSLD, RPA, and RITF, since there would be a decrease in vaccine effectiveness over time for more vulnerable people. But while the situation is under control, we want to act in prevention. We will therefore take advantage of the influenza vaccination campaign to administer the third dose to residents in CHSLD, RPA, and RITF. The SIC recommendation is to have an interval of 6 months after the second dose, so this campaign would begin towards the end of October with people of CHSLD and go to private residents for elderly and RITF after. As users and residents receive their second dose in March, April, there is enough interval between the second and the third dose, roughly 6 months. We will await for the recommendation of our expert for other age groups and people living at home, depending on the evolution of the situation. To conclude, I would like to remind you that the virus is still circulating and that we must not claim victory too quickly. We saw elsewhere what happened when we let our guard down. And I remind healthcare workers who haven't yet been vaccinated, it is still time to go and get your first dose. And we can see how those who are vaccinated can once again enjoy some semblance of normality.